I co-chaired the session at BTOG 2025 on the implementation of genomics in the UK. We had a really good lineup talking about some really important issues to UK and the outcomes of patients with lung cancer. We had Professor Sandy Deans, who is the Deputy Director for Genomic Medicine at NHS England, talking about some of the strategic and important policy areas about how we're going to implement a 14-day turnaround time in lung cancer for genomics. What we heard is that it's not just the genomics part of the pathway, which is the part which is holding up the reporting of results, but actually it's every step from the point of first contact with the patient to getting the results out. And such a complex and multifaceted pathway is what Professor spoke about how we pick that apart and how we have a joined up approach to improving the pathway times in order to help us as oncologists make decisions about treatment for patients. We also heard from Dr. Matthew Krebs, who is a consultant medical oncologist based at the Christie's in Manchester, where he talked about the learning that we've had from the pilot study looking at utilisation of circulating tumour DNA to help improve the time it takes to get the genetic results back for patients with lung cancer. What we saw and what he described was a reduction in that time from the first contact with that patient to then the delivery of the results, and how that's having a real impact across the UK. The outcomes that we've seen in the ctDNA pilot continue to be collected, and there is a gap at the moment, which means that we need to continue to recruit patients onto this pilot to demonstrate the impact of it. But there is hope that this will hopefully come into routine commissioning as part of the NHS testing directory for genomics. So we're all very excited about the outcomes from that and how the applicability of this can have across the NHS. Deborah Montague, who is chair of the ALK Positive Association, came and spoke to us about the importance of making sure patients are centre to everything that we do and develop in terms of genomics. The question that was posed is, have we lost the voice of the patient in the genomics pathway? And her answer was that we need to do more to ensure that patients are involved in every part of healthcare, from the pathway at diagnosis through understanding the importance of these types of tests such as ctDNA, and the importance that every single day makes a difference for patients who are going through that diagnostic pathway. It really grounded the whole hall in ensuring that patient advocacy is at the forefront of our mind and ensuring that we continue to make improvements for patients with lung cancer as we go forward. Finally, we had Dr. Magda Meisner, who is a consultant oncologist based in Wales in the Velindre Cancer Centre, talking to us about their experience of the circulating tumour DNA pilot that's being rolled out across Wales. There are different challenges in Wales, but they've embedded it within a research framework so we can understand the importance not only of delivering and improving pathways, but making sure that this has longevity in showing the impact through research collaborations with this. And it allowed us to reflect on the different parts of the UK and how uptake of genomic technologies and innovation is varied across the country. We then had a really proactive and engaging question and answer session with the panel and the audience members where hurdles around the challenges of developing and improving the pathway to make differences to the patients. We heard that one of the ideas is discontinuing tissue testing should we have positive ctDNA results, and we had quite some discussion around the challenges that may pose. We also talked about the realities of genomic medicine and reducing inequalities through making sure that there is uptake for pilots and the innovation, the ctDNA pilot across the UK, and we know that there are still some centres that are not yet using the pilot fully to deliver those meaningful improvements that we'd like to see in patients.